so I will call the Trempealeau County Health Department Board of Health meeting for January 18th to order. And I will certify the open meeting law requirements have been met by proper posting. And on the agenda, the next item is a public comment period. Are there any members of the public who wish to speak?
No, Beth.
Well, there might be other people calling in. I'll ask for the second time if there are any members of the public that wish to speak. And this would be the third and final call for any of the public that wish to speak. We have a 9-item agenda. We need someone to approve the agenda.
Move to approve.
Second.
Sounds like Mr. Johnson and Dr. Baxter moved and seconded approving the agenda.
Close. We'll accept that.
Yeah, that works.
Okay, all those in favor of approving the agenda say aye.
Aye.
Aye. Opposed? The agenda is approved. The last minutes that we have are from November of 2021, since we did not have a December meeting, and those were sent out a while ago. Is there someone who would like to make a motion and a second to approve the November 2021 minutes?
So moved.
Second.
That's Joe and Ron.
I have made the motion. Is there any questions about the minutes? All those in favor of approving the minutes say aye.
Aye.
Aye. Opposed? Those minutes have been approved. Item number 5 is approving, which I don't like to do this, but approving the resignation of the medical advisor and talk about the replacement.
All right, so I'll go ahead and start. Think it works? Okay.
We'll work better that one.
Okay. All right. Gonna go ahead, Beth, and talk about the approval of the resignation. And so we have Dr. Hodis, who has been serving as the medical advisor, and we very much appreciate his help, especially with all of the extra duties required because of the last 2 years. He is willing to stick around until we can find a replacement. I wanted to discuss the possibility of hold on a second. Just given the history of the long-term service of a joint medical advisor and a Board of Health Committee member in Dr. Selkert for years, my suggestion is that we would ask Dr. Breidenbach to serve in the medical advisor role and the Board of Health position upon accepting Dr. Hodis' resignation. So that's the proposal for discussion.
Okay, let's hear some discussion from the committee. I think we should not let Dr. Hodis retire and resign.
Well,
So Kim, you had a concern about whether that would be permissible.
Right, so I'm willing to serve as the medical advisor, but I don't want to do that in lieu of having a voting membership on the board.
I understand.
So if it can only be one or the other, I would prefer to stay as a community member on the board. But if it is admissible by the committee or whomever else
Hello, is this
needs
Sally?
to approve it, to
Hello,
serve in both positions, then I would be willing to do so.
Bill. Sally, can you hear me? This is Bill Bass.
Is
I'm gonna put you on
is
speaker.
there a
Okay.
possibility that we
We're gonna try to make it work.
continue to look for another community member or advisor, whichever one that you preferred, but
Sure.
in a temporary capacity, could you serve as both? I don't even know if that's possible, but I see where you're coming from in your regard. so-
What did legal counsel say about this? Is that,
Okay,
We have Sally.
Beth is just like you, Sally.
I can't hear on the conversation.
She's on somebody's phone, right?
Yes, she's on Aaron's phone, and now you're on my phone.
Okay. We
Beth,
got it.
this is
Did you
Bridget
talk to
Turner.
court
I
counsel
just,
about this?
Yeah.
what I said is if it would be feasible, legally wise, or there's no conflict of interest, that potentially Dr. Breidenbach stay on in both capacities, and then continue to look for a replacement of either medical advisor or community board member, if that's possible, because it sounds like she is willing to do it if need be, but she would prefer not to be in both positions for conflict of interest, right?
Well, I
Or-
would prefer not to. I'm happy to serve in both positions. But if because of conflict of interest or other sort of bylaws of the county I can't, I want to retain my position as a community board member so that I have a voting opportunity on the board.
Okay.
But I mean, I feel comfortable with serving in both positions simultaneously in a long-term way, you know, presuming that corp counsel and the other board members don't see a problem with that.
And you said you have talked to court counsel?
I asked him,
And?
oh, let me read it. Hold on a second.
You may want to speak of
Yeah.
All right, Rick asked a number of questions, and it was regarding to money and the medical advisor not being a voluntary position, and the Board of Health member being a compensated position. Was this questions? Oh no, where'd she go? What a mess.
Hello? Can you hear us, Beth?
Can you hear us, Sally? Yes, sure?
I can hear you.
Good, all right.
All right,
I can hear everybody in the room.
Beth, can you turn off your mic on the WebEx?
I don't have a WebEx on.
We can
Yes,
see
you
and
do.
hear you on TV. Yeah, there we go. Okay. So, all right, so Rick says the process would be for the committee board to recommend the county board chair, that the chair appoint I'm sorry. The issue with the scenario of the joint position per core council is that the medical advisor is not to be an employee of the health department. Furthermore, the medical advisor position is to be uncompensated voluntary position. While being on the board may not appear to be per se an employee of the health department, as a board member, the individual would be paid for the position on the board. Payment of money may not come directly from the health department, however, it would come from the county. While it may be a gray area, I have concerns with the medical advisor to serve on the Board of Health. So my proposal and why I brought it up is this is happening in Jackson County currently and happened with Dr. Selkert for a number of years. So, but I understand if the board obviously isn't interested in.
So there is a precedent that
There-
even in our county.
There is a precedent, but he's hesitant to, and I wish he were here, but he's not. So,
Okay.
but
Dr. Selkirk served for many, many
So
years.
well over 15,
Yeah.
close to 20 years. As a matter of fact, it was Dr. Otis that replaced Dr. Silver.
Someone's speaking, but I can't hear
oh,
anything.
they're talking about the precedent. That's Dr. Baxa and and Carol talking about Dr. Hodis replacing Dr. Selkert, and that there being a precedent for what I'm proposing, the joint position. I'll finish Rick's email real quick. It says, while it may be a gray area, I do have concerns about whether a medical advisor can serve on the Board of Health. I would not want someone to claim that these are incompatible positions and have Dr. Breidenbach and the Health Department get into legal issues for proceeding in this manner. So that's core counsel's input.
Okay.
So I'm arguing precedent, that's core counsel's, and I'm asking you to make a decision so I can move forward.
There's been a precedent, and
Dr. Back says pro precedent.
yeah, so I would say, I would go by what you are proposing if Kim is okay with it.
I guess you want to make a motion to that effect?
I would make a motion to accept Dr. Hodis's resignation, sadly, and also nominate Dr. Breidenbach to be the medical director as long as she can keep her community member position on the board. Is that correct, Kim?
Correct.
I'll second that.
Okay, motion by Dr. Baxa to accept the resignation of Dr. Hodis and accept the Dr. Breidenbach's replacement, given she can serve in both roles and keep her board health membership. Second by Bridget Turner.
Okay. Is there any other further discussion? Hearing no one, all those in favor of the motion, say aye.
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 I will abstain from voting.
And Dr. Breidenbach abstains.
Abstain, okay. Definitely makes sense. Sounds like the motion is passed. So, thank you, Dr. Hodis, for your time of service, and welcome Dr. I always say her name wrong, Breidenbach, to two positions.
Thank you.
Welcome. I have a whole stack of papers for you to sign. Okay.
Then it looks like we're going on to number 6 with the director's report, talking about several staff changes, the COVID update, the WIC update, environmental health update, public health nurse update.
All right, I will try to be succinct. I made notes before I got here, so hopefully we can go. First, I just wanted to, the staff changes. There's a number of staff changes to talk about this month. I'd like to remind everybody that staff changes are happening everywhere, in every industry, and it just, we are not immune to that in public health. The first one is the retirement of Carol Bowick. We have 45 years of commendable public service. So thank you, Carol, for that. And I wanted to ask Carol if I don't know what's appropriate. I've never sent anybody off after 45 years, but do you have anything that you would like to, any parting words that are professional and?
It certainly has been a very enjoyable ride. As I tell everyone, all I had to do was just sit in the chair, and everything changed right around me, as public health is known to do. It just evolves. It changes with our community, with our environment. I started in a position where, as I shared with Aaron today, we were typing the WIC grant, which was in 79. And at that time, everything was in a rush, and it was 10 o'clock at night, and we were typing on typewriters, and we had to have 6 copies. So we had carbon paper, so the other secretary had 3 copies to type on, and I had 3. And it was 10 o'clock, and we were typing, and all of a sudden there was a storm, and we lost current. Needless to say, at 3 in the morning we got done. The director took the copies, and she went home to shower and change and had it up in Madison the next day, which it was due. that was how we got our WIC grant. I wish everyone could have had the experiences that I had. I got to go out to the Amish community with the pertussis issues. I went to all the flu clinics. It was just a very, very nice experience to see kind of a nice home feeling that our county had years ago as well. So thank you for that.
How many directors did you go through?
Aaron is number 8. And I'm almost done training him in.
All right, so I'm number 8. Thank you, Carol, for everything, and I appreciate it. And I have no doubt that I'll be making phone calls to ask for advice and where things are buried. So thank you, Carol. And I just wanted the board to know that the job for the financial manager has been posted, and it will close on Thursday, January 20th of this month. So hopefully, in a month or so, we'll have somebody try to fill her shoes. So the next is the resignation of Dexter Zebro. Dexter is a sanitarian. His is due to a relocation. And I just wanted everybody to know that there's no environmental health staff available until the end of March in the health department. Luckily, you hired me, and I am an environmental health professional, and will be prioritizing new businesses and to make sure there's no delay in licensing if they are up to standard. Imminent health hazards, statute requirement that we cannot avoid, dog bites, and rabies follow-up. There's also a DNR well contract annual review that'll happen in that time frame, but those are all things that I can handle and do in the interim. That job is posted and will close on February 7th. So hopefully by the time middle of March comes, we'll have somebody ready to go in training for that. And the last turnover has been the resignation of Jessica Olson. Jessica is a public health nurse, was a public health nurse for us for 5 years. And we're currently taking steps to explore replacing this position. And so this is with a disease intervention specialist. It's something I've been talking about for a number of months on a temporary basis. I think that there's an opportunity to at least explore if that's something that would be worthwhile replacing one of the nurse positions. We're required to have one nurse position per state statute, and we still have that and would, of course, but I think that we can, I forget the exact number, it's like 124 diseases that have to be followed up on and closed out in the Wisconsin Electronic Disease Database Surveillance System, and somebody has to manage those files, and I think that might be a full-time job or near a full-time job. So that position, the job description's been written up, and I have a meeting with HR later this week to talk about how to advance this idea as a project. That would need a lot of approvals from committees, but we're going to wait to post the job until the wage study comes back to better evaluate if it's a smart decision. I'm hopeful that this position will be a little easier on the budget moving forward. So I think it's a good thing all the way around, but we'll see what happens. So those are the staff changes. We'll move into COVID. There's quite a lot to talk. I'll try to go quickly. Very important, something I'll be communicating in the media often. We put out a press release that got a lot of attention yesterday, I believe, that we are not contacting all positive cases. There are way too many cases for us to call anywhere close to 100% of them. So if you have folks calling you or complaining that they're not being reached out to, there's too many. And we're prioritizing the cases that we're calling as of right now from 0 and up. And just want to explain the logic. Children under 2 can't mask, children under 4 can't distance or can't vaccinate, and young folks have trouble distancing. So we'll start from the bottom and we'll move our way up. The other thing is our vaccination rates, which we'll go over in a minute, for 65 plus are 97%. So, and have more access to health care than the kids do. So that's currently the way that we'll be prioritizing the cases. the ones that we are able to call back. But we're closing out cases right now that are 5 days old that nobody got to, that nobody was able to even call, and they're off of isolation and quarantine. So the volume's too high right now. The case numbers into that, we're the highest level of disease ever in the pandemic. The current 7-day average case rate is 223.1. The previous high was around Thanksgiving time, 2020, and that was at 207.7. That's when there was testing available. That was before the vaccine, and this current rate of 223.1 does not include at-home test. It does not include antigen test. It does not include the sick folks that aren't going in for health care. So we have every reason to believe the number is much higher than that, but these are just the ones that we know about. Currently, today, we have 550 active cases, and that's with the 5-day case definition. That's a lot for Trempealeau County's 30,000 folks. We have 3 residents that are hospitalized and have had, I think since our last meeting, 3 fatalities, with 54 total in the last 2 years since this all started, unfortunately. So moving on to testing, the hospitals are triaging only the symptomatic, and my understanding is they're triaging even those people. If they're known contacts of a known case, it's maybe not worth to use up a precious resource like a test on the rest of that family, knowing that they're also likely positive. I think that's ballpark pretty close, okay? We have inadequate testing that's available throughout the entire country. It's not just a Trempealeau County problem, but the hospitals don't have tests, the schools don't have tests. The Wisconsin National Guard, which was available, was a resource that took a lot of time and wasn't used that often. It is no longer available. So testing is an issue and not a near-term solution to anything. We'll move on to vaccine. Beth, that's what these handouts are for. And Sally, the handouts, there's the state data map, and then I saved the data from the clinics that we've been doing since I started with AMI. So in the 5 months that I've been here, we've accounted for about 35% of all the doses delivered to Trempealeau County residents at this time. We're currently 68.1% vaccinated of folks that have received at least 1 dose of the vaccine. So unfortunately, there is no booster data or anything else to go off of that I have access to, but 68% is good for the 8th most vaccinated county in the state. So it's not the best, but it's pretty good. We've been using the third-party company AMI to deliver 2,619 doses at the schools, employer clinics that we've helped get set up, and event clinics like the county fair or Ashley for the Arts, Cheese Fest, things like that. So 2,619 doses. Again, it costs me about 2 hours of my time per week to help coordinate all of that stuff with the company and the host site. To deliver all of those shots. So it cost us almost nothing to do that work. Let's see, and the CDC has moved from so we're talking about isolation now. The CDC has moved from a 10-day isolation to a 5-day isolation. This happened over Christmas. It definitely ruined my vacation. The CDC, when they held their call for all of the public health folks in the country, said that, just so that you are aware, talked about how this is the first time they've never put out a science brief with any decision that they've made before, and that this is unprecedented. They put out the notice through a press release, which was brand new to them, and so their concerns from 10 to 5 isn't because things are better, it's because of societal pressures, politics, the economy, all the other factors that are involved. So it's not a science decision, and I think that's important to communicate if people are are misunderstood about maybe this means that things are better. Things are not better right now. And then we'll move on to the other departments. We have WIC. WIC had some leftover WIC grant funds where they purchased a new glider and footstool for the employee breastfeeding or pump room that's in the basement for young mothers of the county that work in the courthouse. So I'm glad that they could do that. It's also going to get repainted, the room down there. Environmental health, I touched on it briefly. We have one of them is out on FMLA until March, and she'll be back. And the other one is last day will be next week. But in the interim, I've done a pre-inspection for a business in Blair, just to make sure that we care. We want business to keep going. We don't want to be an obstacle. Whatever's reasonable to accommodate them as best we can. So I personally went out there and looked at their facility and helped them with the licensing paperwork and stuff. And really excited about that business. It looks really nice. So, and as far as the nursing, which is the last thing on my list tonight, the public health nursing, starting this year, we'll be doing walk-in services. So working from home will happen with my approval. It's hard to be a nurse at your house. And so walk-in services for screenings or vaccine for children or whatever clinical services that we might provide at the health department, those are things that walk-in services will be available. Want everybody to know it's been a topic. We'll be changing to a more efficient vaccine clinic service model. The vaccine for children involves clerical staff, it involves nursing staff, and it involves an interpreter. Just the scheduling piece, just so you all know, the scheduling piece previously had 5 different steps with all 3 of those people involved. Clerical can do all of that all at once, and it'll take a third of the time to do the work. So we can have the clerical staff schedule the appointments and also interpret the voicemails and to translate to talk to the Spanish-speaking folks that need to schedule those appointments. In the past, we've also only had vaccine for children clinics with Spanish services because of interpreter scheduling reasons once a month. So we've only been providing services regularly once a month to Spanish-speaking folks. We're going to change that to a Wellness Thursday, which is something that we did pre-COVID, I'm told. We're going to go back to that. We're going to have 2 3-hour blocks, and one of those 3-hour blocks every week will be dedicated to, we'll have an interpreter on site, or at least scheduled so that we can serve them more regularly. And then just want to say again, reiterate, we're not in a rush to replace the current vacancy that exists, and exploring the opportunity to replace with the disease intervention specialist, which is kind of a new idea in health departments, but public health is changing, and kind of what public health is moving forward could be very different. So that's my report. And the second sheet that I provided you guys was the breakdown. There's a spreadsheet. There's 2 sides. But if you go to the back, it's got the breakdown of all of the total doses that we've given in the school clinics and kind of where we've been. And that's the 2,619 total doses. That includes the peds doses for 5 to 11, boosters, Pfizer, J&J, Moderna, and all the different clinics that we've done. We've been working with our school partners. We have 2 clinics every week in 6 different communities, in 6 different schools. So every Tuesday we'll be in one school, in one community, and every Wednesday we'll be in another school. 6 schools total on a 3-week rotation. So trying to, I believe that access is the issue, and that if you provide it in people's backyards, they're much more likely to go to their high school to get a shot than they are to drive to La Crosse or Eau Claire or schedule an appointment. So these are all walk-in clinics. They've been very popular, and as long as people keep showing up, I intend to continue to host them or coordinate them with the company. Dr. Baxton.
Aaron, just a couple questions. On this first sheet, Fox River Mall and or 16th Street Clinic in Milwaukee, I don't know if those,
Oh, River?
yeah, there's Fox River Mall, I would assume, is over by Appleton. And 16th Street Clinic in Milwaukee, so I don't know.
Obviously isn't ours.
Obviously isn't ours.
Yeah.
And so those are
Okay.
two that should be amended to. People will ask, and so hopefully you can clarify, because I have a couple questions too. 68.1% vaccination rate. If you were to take out the 5 to 11 and/or 12 to 17, and say just the adults, what would you say the vaccination rate would be for people over age 18? Would it be 72, 73%? Because right now it's like, I know there's a lot of negative news, but there's also great news when you look at the most vulnerable population, age 65 and over. It's 97.6% vaccination. So yes, you can. And so a number of people will say is like, well, what do these numbers mean? And I'm glad you broke it down into age group. And so positive news is that there's so many people that have been vaccinated. You take out the kids, which are less inclined to get it, but still can get it.
Sure.
And the vaccination rates would be great. Other things too is I know the contact tracing was mentioned, and there are several other counties that are in the same boat, correct?
Yeah,
There's all of them. Person was in the dental office and said, well, why is contact tracing important if Dr. Fauci and other prominent national doctors are saying, well, Omicron is so contagious, pretty much everyone's going to get it. So it's like, with the Delta variant and with the initial, okay, I can see that, or others can see that. But now when the media or prominent physicians are saying everyone's going to get it,
Yeah.
and it's just going to be, and it's like, why is contact tracing
So
as important now?
I just want to say that there's a distinction
So
between.
those are some questions.
The contact tracing, there's a distinction between contact tracing and disease investigation. Nobody's contact traced anybody for months.
Okay.
So that is where you're a positive case and you follow up. The schools
But on the
are-
media yesterday, it said, well, Trempealeau County, because there's so much, said there's no more contact tracing.
Sure.
And those were the two words.
I'd have to look at the
Yeah.
press release. But
And then-
disease
and-
investigation is
yeah.
what we're trying to do as best we can, so why is it important? I think that's an excellent question, and I think that's something that's kind of on the table at the moment, but I don't have an answer this second.
Okay.
So, something that's always being considered, on how much time do we spend doing it. We've already decided, I think, we have 5 disease investigators that work, whatever they can get done in a day, and we have a lot of really good ones that get work done. They push through those and they try to get the prioritized cases to make sure that they make those contacts. But otherwise, we're nowhere even close to being able to contact everybody.
Correct.
So,
Correct.
I'll also say that I get phone calls from people that are quite upset that they haven't gotten a phone call because they just got the test results from the hospital and we don't know about it yet in the system. So there's both sides. People want the call, but the information's the same. So that's my answers.
Okay,
I
it
agree
is.
with, I agree
Yeah.
with you, but it's on the table now. So just not ready to cut it just yet. So
Very good.
It's in discussion.
Very good.
As far as the percentage goes, we were at 62 or 63% before they added the PEDS doses on
Okay.
there. So I'd say we're right about there as far as the community goes. I really, really wish that we had the booster doses because a number of these boosters, 1,651 doses of boosters, seems to me like a pretty good chunk of the 2,600 that's on the sheet. But 1,600 people doesn't at all come close to what the total 55 plus population is in Trempealeau County. So that's my answer, I guess.
Okay.
So the total percentage didn't go up until they added it only went up a little bit from the kids. So,
Okay.
but I will also share, everything is optional in the schools. Nobody has to do anything. I know that's a
Correct.
point of contention. It's totally optional, and I firmly believe that you don't not offer services to people that want them because less people don't want them. They can choose not to do it. It's okay. And it's our job to provide those services or coordinate them, and that's what public health is. But, and I'm sorry, my back to you guys. What people are still coming, and we're gonna still plugging away. When they first put the peds doses, the 5 to 11 doses, I know nobody wants to be compared, but I have no idea what they're doing. It has to be something incredible. Madison-Dane County was 50% like that in 2 weeks. And, you know, every community is different, and I understand that, but there is room. They're the lowest vaccinated. They are the lowest risk, but that is where there's room to grow if people are interested. So, I got my child vaccinated in Whitehall. I know that I saw Dr. Breidenbach with her children as well, and you know, some of you maybe, but it's an option. So, I think.
So, this is Sally. I think we just need to continue to have these clinics in the various communities. A component that we need to keep considering, a factor, is that we don't have public transportation. We don't have buses. We don't have cabs. It's difficult for people who don't drive to be able to get somebody to drive them 40 minutes somewhere. So I've had calls from people who don't drive who said they've appreciated having the ability to go to a local facility and get their vaccinations. So I think we just need to kind of remember that these bigger communities have a lot more resources, and that includes public transportation and other forms of mass transportation, and we don't have that. So these remote clinics really are very important to the people who don't drive and who can't get there.
Thanks, Sally. I agree, and as long as the state approves them and lets us use this resource, I will continue to apply for them every week. So, and we coordinate with everybody. So everybody's got a little piece of the pie, but nobody's carrying all the weight. So it's really been a great partnership with the state and the schools as well. So.
Yeah, well done.
Thanks. Beth, that's the end of my report.
Okay, does anybody have any other questions? If not, let's go down to the review of the agency budget and the vouchers.
I passed out the two different years, 2021 and 2022. For Trempealeau County, the budget books for 2021, they are still open. They do not close until the end of February. So we are still getting bills in that should be added to the 2021 year. Since our last Board of Health meeting, I tried to circle where, to share with you where I kind of thought, maybe where there was of interest of what our expenses are. The largest expense is the object number 210, which is our contract tracers and our interpreters. It came to a large number so far in December it was $12,670. This amount of money will get reimbursed to the county due to the COVID contacts with the state. So I guess that's a good thing. That does show an expense, of course, and it is taking our expense way over budget. But as I can show you later on, there is a revenue base there as well. And it's kind of the same thing on the second page too for WIC. We have a lot of interpreters, and that sum came to $1,528. That for interpreters is reimbursed from the state through the WIC program, so that money will be coming back to us as well. On page 3, there is your equipment for your breastfeeding that Aaron filled you in, the chair and the painting that will be done for the room for the employees. And then 2022 is, it's small so far, but again, you know, the object is our contract tracers in the following budgets as well. For the total budget for the year for 2021, as I said, we went way over what we said we budgeted for, but that was again with our additional expenses, as I had just stated. And I'd like to call your attention to the revenue in the public health that was predicted to be 7,000, and it's at 170,000. And just last week, I did send in a request for reimbursement for 38,000, so that will still be coming. That's pretty well all I have to say. We used up all of our contracts that we're giving money to, and then when that's used up, it goes on to levy, and that it just works out pretty good this year due to COVID. That sounds terrible, but it's the truth. Any questions? Thank you.
Thank you, Carol, for that report and all the thoughts that you've given that report. Number 8, scheduling our next Board of Health meeting February 15th at 6 p.m. again. Is that all right with everyone?
Yep.
Sounds good.
Okay, I will put that on my calendar. And then if I'm looking at my computer correctly, do you have 6:58?
Yep.
Yes.
So I will adjourn the meeting for January at 6:58 p.m.